A general physical exam consists of 4 parts: inspection, palpation, percussion, and auscultation.
Okay, so now we'll be discussing how to conduct a physical exam. So the first part is inspection.
Inspection is a visual assessment of the patient to look for any notable findings on the skin surface such as masses, erythema, rashes, and/or lesions and varicose veins. So we start from the head going down as we do our physical exam per system. This will also allow us to see any movements like pulsations on the neck or abdomen, any edema of the lower extremities, ulcerations, or discolorations. Be particular to the details and always compare your findings to the contralateral side. We should know the significance of each finding when doing the inspection.
And now moving on to palpation.
The next step is palpation, and it is a technique that involves feeling and assessing certain body regions with your fingers and hands. Tactile pressure, whether light or deep, is applied to the skin with the palmar fingers or fingertips to assess areas of skin elevation, depression, grading of the edema, warmth, discomfort, lymph nodes, pulses, organ shapes and sizes, and joint crepitus.
The third part of the physical exam is percussion.
The third step of the physical exam is percussion, and it is done by striking the plexor finger of the dominant hand on the hyperextended pleximeter finger on your non-dominant hand, placed on the area to be percussed in order to produce an appreciable percussion note. This demonstration, the plexor finger is the right middle finger, while the hyperextended pleximeter finger is the left middle finger pressed on the body.
Elbow in a swift motion using one finger, the pointer.
You can liken the production of the sound as to striking a drum. If the drum is hollow, then there will be an appreciable sound. And if this drum is filled, then the sound is dampened. So you use these for areas that are hollow or air-filled, such as the lungs and abdomen. If the area that you are examining is the lungs, then the sound will be described as resonant in normal individuals, dull on percussion when the lungs are fluid-filled, such as cases of pleural effusion, and lastly, hyperresonant in cases of atelectasis or pneumothorax. If the area of examination is the abdomen, then we describe the sound as tympanitic in normal individuals, or dull in cases of ascites, and lastly, hypertympanitic in cases where the abdomen is subsequently distended.
And lastly is auscultation.
The diaphragm and the bell of the stethoscope are used to identify the location, timing, length, pitch, and intensity of heart, lung, and bowel sounds.
So how to properly wear your stethoscope? First, the earpieces, make sure that they are pointing forwards along with your ears. So when you wear it, like this. And moving on to the end of the stethoscope, you have the bell and the diaphragm. So remember that there is a notch or a dot at the end of your bell and diaphragm telling you which side it's on. So right now, this is the bell, and then twist it. Now it's on the diaphragm.
It includes noises from the 4 valves closing, extra sounds from the blood flow into the atria and ventricles, as well as murmurs in the heart. Auscultation allows for the identification of abnormal sounds such as bruits or turbulence in the blood vessels. We could also use the stethoscope to hear any bruits from the jugular veins and carotid arteries, as well as assess the bowel sounds in the abdomen, whether it is increased or decreased.
That ends.
Thanks for watching. This has been the APMC-SN Office of the National Vice President. See you in our next installment of the Basic Professional Toolkit series.